Hello, everybody. My name is Dr. Haas. I am the prosthetic dentist at New Life Dental Implant Center. I've been doing this for the past 10 years. The purpose of my talk with you today is to help clarify some of the uncertainties that I've heard from patients when they first begin their journey into looking for implant rehabilitation. So I want to go over expectations, what to expect from your consultation, things that we're looking for to see if you're a great candidate for this procedure, and how we can optimize your success. Let's talk about the initial visit with us. So on your initial visit, the most important thing that we obtain from you is medical history. Now, the medical history is a huge predictor of implant success because we are looking for things that hinder health. Now, the four things that we're really looking into are any history of tobacco usage, any history of diabetes, if you've had a history of head and neck cancers, and if you're on certain medications that treat osteoporosis. These are very critical for us to understand so we can best formulate a plan to help you achieve your goals while making sure that you're optimized for success and longevity. Once medical history is completed, you will be taken back by one of our assistants who will be taking a three-dimensional scan of your jaw. We get to see where your nerves are, where your sinuses are, how much bone density you have, how much bone thickness you have. And it helps us engineer where we want to place the implants to be able to achieve a stable bridge for long-term success. Another frequently asked question is if I currently have a scan, can I provide that information to you? And the answer is absolutely yes. Now, it needs to be in a readable format. Normally, these are either come saved on a CT, a digital file, or a USB. If we're able to see every section of your 3D scan, we can absolutely utilize that with our software. For our out-of-state patients, you can provide us with a CT that your primary care provider has taken of you, or if you haven't had that taken yet, we can work together to find you a radiology center or an imaging center that can obtain that scan for us. Then you can send that scan to us, we'll review it, we will meet online via Zoom or FaceTime, and then review the case together, plan it out, and go over all the information necessary. Once your CT scan has been processed and has been rendered, we will have you sitting in one of our operatories that has a large TV screen in front of it so that we can sit together and review all the details that are pertinent to your case. From there, normally what I review with my patients is their risk factors. Now, patients come from different aspects of life, but we see common patterns amongst the patients that we see. Either patients are coming in with no teeth, essentially a history of dentures, that they've been having a very rough time because they've either lost too much bone for that denture to be supported by, or they're tired of using so much glue to keep their teeth in and are looking for a more permanent solution. The other category of patients that we see are patients who have been dealing with tooth-related issues for a good portion of their life. They're dealing with high decay rates. They're dealing with teeth that constantly require root canals or changing crowns and restorations. And a lot of the times, these are patients who have a lot of other systemic issues, health issues that are affecting their mouth. They suffer from dry mouth, which is very common in our patients who are taking very common medications like blood pressure medication, diabetes medications, antidepressants. When the chemistry is not right, teeth will begin to have issues. And it's a very great privilege of ours to be able to help patients who have had this headache of dealing with teeth getting ill for a good portion of their life and changing their risk factor and providing a treatment that may not provide so many headaches for them. If we can change a patient's life from having to deal with teeth that are going downhill because of dry mouth or because they have constant acid reflux or a pH issue, and give them a treatment that no longer is affected by that, it's a huge win for both you and us taking care of you. And then the last group of patients that we see are patients who the teeth look pretty pristine, no decay or any restorations, but they've suffered from a very aggressive disease called periodontal disease, which causes bone loss. Now, one of my biggest goals for these patients is to help save their life from certain aspects that are related to periodontal disease. And if we look at the data and the literature with periodontal disease, it's linked to 56 other diseases such as stroke, heart attack, Alzheimer's, and to be able to switch that off for a patient and allow them to be healthier and have longer longevity in their life is a huge goal that we would love to accomplish. So one thing that we also discuss with our patients is being the appropriate candidate for this procedure. You know, at times we have patients who come in who are very frustrated with either their dental history or that the fact that their teeth need a lot of work, and they just come to us saying, hey, just get rid of all my teeth and give me a bunch of titanium. Now, as great as titanium implants are and as great as they've worked for the past 20 to 30 years, it would be a disservice to just say, yes, let's take all your healthy teeth out that can be saved with good quality dentistry and put a bunch of implants in. Because implants are not a one-time shot. It's not like you get it done and you're never going to have to revisit this. The things that we look for that we discuss with our patients is age. You know, the younger you are, it's just like getting a knee replacement. You will have to have revisions later on. So our discussion together is mostly to go over your expectations, your goals, your desires, and then to make a plan that addresses those goals and desires and wants without putting you in a worse spot after 10, 15, 20 years. Because everything will work great for the next year, the next few years, the next 10 years. But what we're looking for is long-term success. So once we sit down together and we review your risk factors, I go over your dental history together, and I get a better understanding of what your needs are. Then I sit and we start to plan your implants in real time. So we use a very sophisticated software that has implant models built in. It has your 3D images built in. And then I can sit down and see where you have real estate to place the implants. You know, we hear about the all-on-4 prosthetic, and one common question that we get is, you know, what are the big differences between doing an all-on-4, all-on-6, all-on-X? These are all different implant treatments that are based on the number of implants. All-on-4 being 4 implants, all-on-6 being 6, and all-on-X being anything more than 6 implants. Now, the biggest criteria to help us decide which one is best for you is your risk factors that we talked about. If you're a heavy clencher, if you have very strong jaw muscles, well, we want to over-engineer the case. If you have that disease that we spoke about earlier, periodontal disease that affects the bone health, well, we want to over-engineer the case because you already have a history of poor bone quality. If you have certain systemic illnesses like diabetes or you're a smoker, well, we need to plan for a rainy day because these are things that can reduce the success of your implant. Now, during our initial talk, when we review your medical history, for instance, if you're diabetic and your A1C level is above a certain cutoff that makes you not safe for this procedure, well, me and your doctor will be working close together to help you manage that A1C. I've had patients who come to us with a very high level, say 14, and after 3 to 4 months, by working with their doctor, putting them on certain medications, certain things like Ozempic, we're able to manage the A1C to a very safe level. And then from there, the most important part is on you, the patient, to maintain that healthy level so that, again, we can optimize your success for dental implants. So that's another criteria that goes into us planning what is the most appropriate treatment for you. Now, another question that comes to us is, well, doc, I've heard from another provider that I don't have bone and I'm not a candidate for dental implants. And while they may have been right many years ago, it is not the case now. And again, the techniques that we use are nothing new. They've been around since the 70s, but with the advancement in implantology, it's become a lot more of an efficient process. The surgery has become a lot less invasive. The predictability of it has gone up as well. And most importantly for the patient is the affordability is there as well. So what do we do for cases and when the patient comes in, either they've been wearing a denture for 20 plus years and they've lost a lot of bone volume, or they have a history of a lot of dental infections that have degraded the bone, or periodontal disease that has caused a major amount of bone loss. Well, the techniques that we use, which is a lot more pertinent for the upper jaw, where most patients are deficient in that bone, is we use extra anchorage sites. So we use other parts of the facial bone to secure our implants in. Now, there are 2 common bones on our face that are some of the most stable, most dense, and some of the last bones to go away even with natural aging. And those two bones are one called the zygoma, aka the cheek implants, or the other bone that we use is the bone at the very back of the jawbone. Now, this is a very specialized procedure. It takes a very highly skilled surgeon to do this, but this has been a game changer for us. Not only are we avoiding what we used to do 10 years ago, which in a case when a patient came to me with no bone, most of the time we are doing double sinus lift surgery where we go into the sinus, we lift it up, we place bone so it doesn't fall back in, and let it cook for 9 months. A very predictable procedure that we were doing, but the timeline for the patient was pretty hard. You're waiting for 9 months. So what we do now is we avoid the major bone grafting. We avoid having to enter the sinus to do any form of sinus lifting. And what we do is we use those two bones that we talked about, which allows us to give you teeth in 24 hours and to give you a very stable prosthetic because we're able to put the implants in very strategic areas of the jawbone. One thing with medical health, just because your health is not where we need it to be for surgery doesn't necessarily eliminate you from being a candidate. What it does mean for us is we need to spend some more time together to really help you get to the point where your health is on board with not only being safe for surgery so that we can minimize any form of complications, but most importantly, putting your implants in a position that biologically, with your biologic system, with your physiology, will be cooperated and that can last you a long time. So if your A1C is high beyond our cutoff, again, we will be working together with your doctor, and of course you would have to put in your form of commitment into this process to help bring those levels down. But from my experience of dealing with patients who come in with very high A1C levels, it's been doable for us after 3-4 months. If you're in a position where, for instance, your vitamin D levels are low, which is a huge factor for implant success, we work on vitamin D optimization, where I put you on supplementation about 4 to 5 weeks prior to surgery to help optimize your system. If I see that, for instance, your your blood values are not cooperative with our surgery, again, we will be working closely with your doctors to help you get to where you need to be. So there will always be hope, but part of that is the commitment that we will provide you, the commitment that your primary healthcare provider will provide you, and the commitment that is required from you to make all of this work as well. Once we've sat down and we've formulated a game plan together, whether that's to do an all-on-4 or all-on-6 or to do some form of bone grafting or to use cheek implants and whatnot, then we will come up with a treatment estimate for you. Our patient ambassadors will sit down, they will review the treatment estimates. They are all highly trained to even answer some clinical questions that you may have after I leave the room. And usually us doctors are highly available for you, so even after your consultation, if we leave and you have questions, we'll find a time to come back and answer those, or to link up via Zoom, phone, email, so that you have a chance to get all of your questions answered. But once you are there with the patient ambassador, they will review all of the financials with you. They will go over financing options to see how we can make this best work out for you. Once you have committed and you feel comfortable with us and you would like to move forward with us, then we get the ball really rolling. Your first actual establishing appointment with our practice is after your consultation. This appointment is usually about a 2 to 2.5 hour appointment where we will be reviewing all of the details of the procedure from A to Z. It is like drinking from a fire hose at times, but you will be given a lot of papers to review and a lot of great information so that there are no surprises for you. Once that information is reviewed, we will be taking 3-dimensional scans of the inside of your mouth. So most patients may be used to traditional techniques where you bite into some form of putty, you wait 10 minutes, you're trying not to throw up and gag, and you're hoping the dentist comes and takes that out. Well, good news is we have great technology that has saved a lot of gagging moments, a lot of discomfort. And it's something called a digital scanner, where we have a 3-dimensional sophisticated camera that goes inside your mouth and it captures all of your anatomy at a very precise margin. Once we have those scans, then I will review to see how your bite is, how your gum tissues are. So we have all of the data needed to sit down and formulate and finalize our game plan for your surgery. Now, prior to surgery, one of the most important things that I emphasize with patients is getting your medical documents so that we can clear you for surgery. On our team, we have highly trained surgeons who will be reviewing all of your medical documents. We have our own medical anesthesiology team whose sole purpose is to make sure you're comfortably sedated and safe during sedation. These documents will be reviewed by all of our team, our prosthetic doctor, our surgical doctors, and our anesthesiologists. Once we've reviewed it and cleared you for surgery, you're essentially ready for surgery. One thing that I really take a lot of pride in for myself, and one thing that I focused a lot of my training in my earlier days was, as a provider, I'm dealing with a very vulnerable population, a population who is lacking a lot of self-confidence because of how they feel about their mouth. They feel like they've been judged in the past. They feel like the image of their mouth reflects on who they are as a person. And I want to let all of you guys know, I really pride myself and my team and our offices in being so compassionate and empathetic towards our patients. We are a complete judge-free zone. Our biggest honor is to have a vulnerable patient come to us and allow us to help change your life, allow us to see not only the mental change that you go through or the physiologic change that you go through when you get a new set of teeth, when the mouth becomes healthy, but that long-term sustenance of it. Seeing my patients year after year when they come in for their checkups, talking about how much better their life is, how much more they're enjoying their life. They're able to eat, they're able to go out with friends and family, they're able to take wedding pictures if their kids are getting married. These are all things that bring a lot of joy to us, and I just wanted to let you know from the bottom of our hearts, we're here to take care of you. We're here to help you get to where you need to be, and it's a huge honor to take care of you. I'm sure you're nervous. I'm sure you have a lot of different things coming through your mind. I'm sure you're even thinking about not showing up to that appointment from the nervousness, but let me talk you through it. You know what to expect, and I can put your heart at a bit more ease throughout this consultation appointment.